10 years later, we've identified 11 conditions that require individuals to carry their own life-saving time-critical meds. That affects over 27 million Americans. And another 5 million Americans have conditions that require some type of specialized care that is outside of standing scope.
Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Today's guest is a true champion for families facing life-threatening emergencies with bleeding disorders. Darlene Shelton is the founder of Danny's Dose, an organization born out of a traumatic experience and powered by one goal: to ensure that emergency responders are equipped and authorized to administer life-saving medications. Her story reminds us that advocacy doesn't stop with hemophilia B. It extends outward, improving systems and saving lives across the rare disease community. Darlene, welcome to the podcast.
Thanks for having me, Kai.
Of course. Well, as always, I just wanted to start off by just telling us about your story, your connection to hemophilia, and that moment that kind of sparked where you're at today.
Okay, so technically it is my daughter-in-law's side of the family that has hemophilia. And like so many families, had no idea. No one had been severe enough to ever be diagnosed until our first grandson, Danny, was diagnosed at 11 months with a very major mouth bleed. And so that was the day that I say that we became a rare disease family. Mm-hmm. And a part of the Hemophilia B family, which we very shortly connected with the coalition, which was one of the best blessings ever to be part of the coalition. Really, at that time, we're just a family that thinks ahead. And we thought about, what about an emergency? What do we do? And we asked the doctor, we realized we have a home health nurse coming and doing his infusions. That home health nurse is an hour away. What do we do if he has an emergency bleed, gets hurt,
falls off a bike, car accident, life happens, right?
And the doctor said, it's standard push IV. You just call 911. Those people start IVs all day long. Just call them. They'll get the meds on board. Get to the treatment center, which was an hour away, by the way, where they lived at that time. And no big deal. But he said, now, you never leave home without your clotting factor. Because there very possibly would not be time in that hour drive for someone to go all the way home and get the factor and then come all the way to the hospital. The nearest hospital was 20 minutes from their home. And he even said, even that 20 minutes there and back could be too long. Mm-hmm. So, of course, we were new. Of course, what did we do? Well, we put plans in place. We had his go bag, which we still call it the go bag. It's a backpack that has the emergency dose in it. And I even thought to the doctor, I said, well, can you write something that says his medication and his dose, because they might not believe us. Right. Or what if, the adult is hurt and can't tell them what the dose is? And the doctor said, great idea. Sure, I'll do that. And so he did. He wrote on letterhead. I didn't know at that time that's called emergency orders. But at that time in our lives, I thought, okay, we have a doctor's note that is official. So we thought we were good. Emergency bag, ready to go. The emergency orders, we know now, is what that's called from the physician. And we had a medical alert symbol on Danny's ankle. He was little at the time. And then I even created a headrest cover that said, son with severe hemophilia B. And in that pocket on that headrest cover stated where his medication was, in the brown backpack. Wow. And so we thought, okay, in an automobile accident, even if mom or dad can't speak, he would be protected. We thought we had everything in place. Mm-hmm. Until fast forward 3 years. So for 3 years, we had lived this life. I call it living with our rose-colored glasses.
Okay.
Until at a meeting, my daughter-in-law was at a meeting with Wayne Cook, who is the president of the Coalition for Hemophilia B.
I would know that name, yep.
Yes. And Kristen was just talking about everything we had in place for an emergency. And Wayne said, well, that sounds really great, but it won't do you any good. And Kristen said, what do you mean? And he said, well, I was in a car wreck in New York and although I had hit my head, I was still alert enough to call 911. I had broken my wrist. And when EMS got there, they informed me that they could not give me my medication. And so they talked a little more, and, Wayne went into his story about trying so hard to convince them to give him his medication, and they couldn't, they weren't allowed. And then they took him and his medication to the emergency department. And guess what? The doctor there, the emergency physician, says, I'm not administering a medicine you carried into my ED. So long story short, Wayne is okay because his wife got there and treated him. But he was on a waiting list for a CT to see if he needed his clotting factor, to see if he was having a brain bleed. And luckily his wife got there, and that's why Wayne is still fine.
Right. And I think all along the sense is, well, I thought I covered my bases, and it turns out even at the highest level of medical care, there's a lot of holes.
Yes. And Wayne's accident had been several years prior to that. And so this was 2014. Around summer of 2014. So, of course, I thought, okay, this has to be something old. Maybe it's just a New York thing. And when Danny was diagnosed, I had gone to visit our local EMS. I live in a small town, and he is our grandson, only here, X amount of times a year. But I went to go visit them, and that visit went great. They said, oh my goodness, can you bring us the information out of the inside of the medication? Can you get us a copy of the instructions that the doctor wrote? We'll get a treatment plan set up. And we had a really good meeting. They called back, had a couple of questions. Next thing I knew, we have a treatment plan. I didn't know that wasn't normal. I didn't know that wasn't the norm.
Right.
They didn't think to tell me that wasn't the norm, that was a special treatment plan only for our grandson, not even for another family that might be driving down our interstate.
Sure.
And so it was 3 years later after that, speaking to Wayne. So I call them back up because they're friends. And I'm like, what in the world?
Right.
And they said, oh, Darlene, we're so sorry. We didn't realize that you didn't know that that's the norm. No, we aren't just allowed to administer medications that aren't on our ambulance. And I said, I was so shocked. Honestly, for about 2 weeks, I walked around in shock. The fear of what could have happened.
Sure, of course.
The fear of what could happen tomorrow. What in the world were we going to do? And really not just our family.
Right.
All of our friends. Like, how could this be okay in 2014? Not the dark ages.
Right.
Like, I was just so shocked I couldn't get my brain wrapped around it.
Right. And to reiterate, this is all because there's a list of approved, medications or procedures that, an EMS is allowed to administer given in any given emergency.
Yes.
Okay. Gotcha.
Yes. And it's called, they have their formulary, which is their list of medications, and then they have their scope of practice or their protocols, their standing protocols or standing scope. They're kind of used interchangeably.
Right. And so then clotting factors, again, just to reiterate for our listeners, aren't, at the time, were not a part of this list.
Not at all.
Gotcha.
Not at all. And so I'm this crazy person that I kind of go to the top. I literally started.
I don't think. Okay, you say crazy. I would say thorough, determined, confident, because you have a grandson that you are trying to protect.
Yes,
and I think that's important to note.
Yes, and so I didn't really know who was in charge of EMS as a whole. I assumed it had to be HHS. Department of Health and Human Services. Mm-hmm. You would think that's where it falls under. So I started calling the U.S. Department of Health and Human Services and also the Missouri Department of Health and Human Services. And I would call one week and email the next and call one week and email the next. And that was probably from about July to December, and I never got a single reply. And out of sheer frustration, I reached out to a good friend who was just elected as our state representative, who happened to be a nurse. And my email was her very first email, her very first day in office of January 2015, with me saying, we need your help. I don't know where to turn. I don't know where the answer is. But in 2015, there has to be an answer.
Right.
This is crazy. And that is what began the ball rolling. Even at that time, our family had not thought about a nonprofit at all.
Sure.
We were just trying to raise awareness, honestly, to get somebody else in gear. I will be perfectly honest.
Yeah.
We were really trying to get somebody else in gear to do something. And she was terrific. She didn't know exactly who to contact, but said, I'll find out. And that put us in contact with our state EMS association. So FYI, everyone, every state has a state EMS association. And basically just think of it as a board. And you have a state EMS medical director who is over that association. And it's made up normally of regional medical directors. So every state is divided into regions, we now know. And cumulatively, they come together with a few other people from HHS and a few other players on that team. And they are the individuals that review and set regulations for your state. So we quickly learned that. We were very fortunate that in Missouri, we have some very broad thinkers. And at the beginning, they didn't realize how it could be done. So I remember in the meeting saying, and Danny's 3 at this time. 3.5. And I remember at the meeting saying, he can mix his own factor. He mixes his own factor at 3.5. I am fairly sure that a trained paramedic can administer this medication. It is not rocket science, and it's standard push IV. And we all know they start IVs all day long, and they're going to start an IV anyway, almost exclusively. Almost everybody gets an IV started. So why can we not allow them to administer these meds that are super simple that a 3.5-year-old can mix? And I think that was really one of the keys to get them to rethink their position. Because let's face it, hemophilia sounds hard and big and scary.
The stigma of it all. And I guess leading up to this moment, as the founding of Danny's Dose is kind of coming to life, or maybe the realization that we need to find something to kind of help spread this word. Did you realize that you were advocating throughout? Like, did it feel like that? Like, because I think a lot of what we want to share is that advocacy is not a scary thing. And advocacy is, as simple as writing a letter to your state EMS board, or, being there for your child or friend who has hemophilia B. So I guess talk a little bit about, did you realize you were doing that throughout this process, or what was that feeling like?
In the beginning, no. we didn't even use the word advocacy.
It's like, I'm going to go advocate for our grant. Like, it's not like you were like...
Not at all. We saw a real problem.
Mm-hmm.
And I honestly remember at one of the first meetings saying, I fully believe that a lot of smart people can get in a room and create a solution to this problem because it is not astronomical. It's doable. Americans are treating themselves at home across the United States. We need to make sure that our paramedics can when we can't.
Mm-hmm.
So no, we didn't put the word advocacy to it. We were going to have meetings to make sure the issue was known and to basically get people in gear for a solution.
Right.
And really, we really thought there would be a point at which we would just step back, that we would have made it known and they would go take care of it and then we'd be done.
Right. So, well, I guess then tell us about, of course not. Well, you don't seem like the type who would maybe step back to let that happen, right? Your pragmatic approach, I think, to all of this is probably what has cut through a lot of the bureaucracy and the red tape. It's like, hey, guys, are you not seeing this? So I guess tell us about Danny's Dose then, the overview of the mission and, what are you setting out to do?
Okay. And as we learned from the friends that we made in Missouri that were at the EMS and the state level, and then many of those also served nationally, we learned that, okay, it's not just New York. It's not just Missouri. They were in Alabama at the time. It's not just Alabama. Oh my goodness, it's nationwide. So 10 years ago, before we started Danny's Dose, across the nation, paramedics were prohibited from administering any medications not on their ambulance. There might have been little pockets here and there with a broad-thinking medical director that had written a new regulation, but that would have been very, very one-off, and we didn't know of any at the
Right.
time.
And I'm sure not shared nationally when those little pockets do arise, right?
No. Probably based on need. Probably a hemophilia family in the community they learned about. And so they wrote basically a special guideline for that family like we had in Starter County.
Yeah, like you received, right?
Yeah, so Starter County had one. But those little one-off pockets, you certainly couldn't bet your life on that. And you certainly didn't have the freedom as a family with a bleeding disorder to know that to feel like you could just travel around, go on vacation. I mean, it was really like paralyzing almost for us. They lived in Alabama and we were in Missouri, and that trip was made all the time.
Mm-hmm.
The fear that then set in on what if there is a wreck?
Right.
What if there is a wreck? And just living with that, we knew, okay, this is not just a Missouri thing. This is not just a Darlene Shelton thing. We've got to go broader. And I remember the day sitting on my son and daughter-in-law's in their living room and saying, there's got to be other conditions that require people to carry life-saving meds.
Right, of course.
I have no idea what they are, and I wonder how many it will be and how many people it will affect. So 10 years later, we've identified 11 conditions that require individuals to carry their own life-saving time-critical meds. That affects over 27 million Americans. And another 5 million Americans have conditions that require some type of specialized care that is outside of standing scope. So maybe many of them are contraindications on medications that are normally used on an ambulance. Still just as important.
Mm-hmm.
Either what does not happen is just as important as what does happen when it is in regard to saving your life. So total, we are now advocating for over 32 million Americans to be able to receive prompt and proper emergency care for their condition and for them individually.
Wow. Well, it's extremely impressive, and you're doing incredible work. And again, just to reiterate, born out of love and care,
yes.
Not, and of course that word advocacy is an umbrella term, but really what it is you wanted to protect your grandchild, and living with that anxiety and fear of like projecting a potential scenario. It's just not a healthy way mentally for us to go about our lives. So I guess maybe let's transition a little bit into what you've learned and what families should know. And then I think maybe we'll wrap up with how can families advocate within their states concerning, helping Danny's dose, rather.
Yes. Okay. So if you go to our website, right on the homepage, we have a map that shows the states where we've been able to make regulatory updates, either legislative or regulatory updates. We're at 19 right now. I say that even in those states, one of the main caveats I will say that every patient must do, even when we've made regulatory changes that now allow a paramedic to administer medications rather than prohibit, it is based on the orders of the patient's specialist. So as a patient, you must carry your emergency dose in the original packaging with the prescription label in a clearly marked bag. Moms, not in your purse. In most states, they're not allowed to go through a purse. That's your private information.
Oh, interesting. Not because of your damage, but because a purse is private.
Yes. And you have to have those emergency orders. Even in Missouri, where we passed our bill first in 2017, and education is broad, awareness is broad, you have to have you have to have all those steps in place. Emergency orders, medication clearly untampered with the prescription label. As one of my retired buddies, EMS buddies said, Darlene, I have to know this is Bob. I have to know this is Bob's medication, and this is what Bob's doctor has instructed me to do. Then I could save Bob's life. So we need everybody to be Bob.
Yes, be Bob.
Be Bob. Wear your medical alert. Also, my EMS friends say to recommend the medical alert necklace. Because if you're hurt, they are going to check your heart. They're going to check your breathing. They're going to feel your carotids. They're going to look at your eyes for pupil dilation. They're going to be looking for breath. Where is that? That's on your chest, your head area.
And so then
and they
have
told me, quite honestly, we don't care much about your arm or your hand.
Mm-hmm.
It's rare that they check your pulse in your hand because they're looking for your pulse up, like by your heart and your neck. That's your vital area. So they recommend also a medical alert necklace. Not part of any companies. Get the necklace instead of the bracelet. Do the necklace. And then another thing that our families can do, the second step that you need to do is go meet your local EMS service. Just call up and say, hey, we live in your area. We're a family with hemophilia. Or if you're listening, whatever condition you have, and maybe you're a hemophilia family with more than one condition,
right?
Information that you may need, and just get to know each other. Maybe bring the kids, and they will love it. Believe me, they will love it. And you'll have a couple of meetings. It will probably take 3 to 4 meetings. I also have an outline on the website that says what you should expect, information you should expect to take that you can gather first before your meeting, what you should expect that meeting to include, and what a good treatment plan should include. Even down to the point, a good treatment plan should include where a helicopter is going to land. If it's a very critical injury and you need to be life flighted to a level 1 trauma center. So I have all of that on the website as well. So I call it the steps to protection. It's 8 basic steps to protection that every single family should include in their everyday life, including school and work, different things like that. Going and visiting your local EMS service will automatically bring awareness, I call it up the chain, because there will be calls to their regional medical director, to their state EMS association.
So your simple phone call could potentially have a very large impact, like a ripple in the pond, right?
Yes. And at this point, I attend so many EMS conferences, even those states, when you look on that U.S. map that are still, I have them in a very ugly charcoal gray color because we're not happy with them.
I love that. I bet they know you by name, huh?
They've probably heard of us.
I'm sure.
And in those states where they've not made a regulatory change yet and education is not happening, we have to have the families. Sometimes I can be disregarded as the grandmother from Missouri.
Sure.
But if the grandmother from Missouri is just leading the way to multiple families in a state, they can't ignore that. And so we need everybody to work together, particularly in those states where changes haven't happened. And by all means, I answer my phone, I answer emails, reach out. I am happy to help in every way that I can.
That's amazing. What I'm appreciating is you took a very strong skill set, which I assume is detail-oriented, passionate, right? And you put that into an action plan. But I know for so many of us listeners, it's hard to take that step outside of our comfort zone. Being detail-oriented is not a strength of many of us, right? So visiting dannysdose.org, all the work that you've been doing for years is right there in very simple, actionable steps. And so, Darlene, I think maybe just to wrap this up, what gives you a sense of hope right now in this advocacy space? Because it can be a very kind of scary and daunting time given the amount of change that we're going to see over the coming years with healthcare and access to it. As you kind of look at the work you do, like what gives you hope and what kind of message can you share with our listeners about staying together and being in this together?
I think part of that is exactly it. I'm so connected with so many rare diseases, and we really, truly are a family. We call it our rare disease family, and that's not just words that we use or words on a paper. And when you start in advocacy, and I don't even know that I like that word, start building friendships. I really call it friendships.
I love that.
You really should build a friendship with your local emergency personnel, with your state representative and senator and their office staff, with your U.S. congressman or woman and senators and their office staff, and show that you care. Ask them about their day when you get that meeting. Don't just always make it be about your mission, and please don't go in hateful and negative. Build a friendship. Be willing to be part of the solution, because we never placed blame and we never made the responsibility be theirs. We were always, as a family, showing up to be part of the solution.
Right.
And it was eye-opening, and it was different for them because I was told that so many times when a family would ask for a meeting, they just came in and yelled and screamed and pounded the desk.
That's not going to get you anywhere.
And
right?
That's not a solution.
Right.
Be willing to be part of the solution, build friendships. That gives respect to you. It teaches your children an awful lot if you have kids.
Yeah, lead with empathy, right? And
Yes.
as often as you can.
Yes.
It's not the EMS personnel's fault that the rules are the rules, and there could be a hole in the training.
Right. Absolutely. And you very likely will be the person training your local EMS better than anyone else.
Right.
I'll throw in one thing. We're very proud to have completed the very first EMS medical clinical guidelines for treatment of individuals with bleeding disorders, also available on the website. Also take a copy of that when you go visit them because they're new. And we will be hosting the very first educational session for treatment of individuals with bleeding disorders at EMS World in October.
Wow.
And I am super proud of that.
Yeah, congratulations.
It will be CE accredited. It will be available to EMS broadly through EMS World, and we will continue with that education in 2026. So we're trying hard to fill the gaps and, cross the hurdles and to provide to families the things that maybe they don't even know need to be provided. And we've learned it because we're part of that world.
Sure.
Serving as that liaison between EMS and our families and being able to speak to both sides.
All right. Well, thank you so much for your time and your energy and contributing your voice to this podcast, Darlene. We really do appreciate it. And this has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership Balancing Life's Issues. And thank you once again for your time, Darlene.
Thank you.
Until next time, everybody, take care. Thank you for listening to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send us an email at podcast@hemob.org, and don't forget to stay connected to your community at hemob.org. Anything else to add, Miles? This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.